The next one is you mentioned breast health and progesterone. I'm a reverse responder and taking very low doses of oral bioidentical progesterone while using estrogen, testosterone, and DHEA after a full hysterectomy. Will imbalanced progesterone, meaning too low of a dose, cause breast tenderness? I'm so confused and really don't know where to find clarity when my doctor has no answers. So this is from Laura Lee Adams. Laura Lee, this is a big one, and I want you to know I see you, and this is a good thing to talk about. Yes, not enough progesterone will cause that, but it's a combination. It's estrogen here and progesterone being here. That's when you have that problem. We want your progesterone being here. So, transvaginal, if you're not sexually active, if you're sexually active, a rectal suppository is a very, very useful tool. And then we run your lab work. Now, if you're menopausal, we want your progesterone somewhere around 5 month long. That's a good number. All month long, around 5. That's a great progesterone level. And then we want your estradiol. What's the least I need to use at the end of the day? You know, if you're doing, estrogen, where so estradiol for me on a lab, 82 in the literature shows benefit to bone. Okay. So 82. If they're not losing testosterone, I'm going to push the estradiol towards 82 and make sure they're maintaining bone density. But if they're using testosterone, testosterone also helps with bone density. So I can use less estrogen. Sometimes we'll use someone's estradiol and the lab work will come back in the mid 30s or 40s, as long as you're not having side effects, breast distension, of course, hot flashes, night sweats, vaginal dryness, urinary tract infections, all those things that show low estrogen. I'm fine with your estradiol being at 32, and then that progesterone, around 5. That's a great balance right there. So I hear you that you, as a reverse responder, you can't do high dosing oral. So this is a better way of doing it. So try that, and you should never settle for breast pain. No woman should ever have breast pain. Every month you have breast pain, that means your estrogen is overstimulating tissue without having progesterone inhibiting that stimulation. If you stimulate tissue over and over and over again, at what point will the cells duplicate inappropriately, leading to pathology? That's the question. And why even try figuring that out? Let's just not let it happen. No more breast pain.